Are your legs not feeling the way they used to? Maybe it's getting harder to walk upstairs, or your balance feels off, or you're noticing strange cramps, tingling, or even a heavy, tired feeling in your calves. It's easy to blame age. But what if the real reason your legs are struggling has nothing to do with how old you are and everything to do with what your body's missing? Most people don't realize that just a few vitamin deficiencies can quietly drain the strength, energy, and stability right out of your legs. But the good news is, the fix isn't complicated. In this video, we're going to uncover the 4 most powerful vitamins your legs are begging for in nutrients that can help restore nerve health, boost circulation, rebuild muscle, and even protect your bones from breaking. Whether you're dealing with pain, numbness, or just want to stay active and independent as you age, you won't want to miss this. Let's get right into it, because the strength in your legs is far too important to ignore. Number 1, Vitamin D. Vitamin D is one of the most powerful yet silent supporters of leg health in seniors. It doesn't shout with flashy symptoms, but when it's missing, the consequences gradually show up as weakness, wobbliness, pain, and even fear of moving. It's a fat-soluble vitamin, which means it's stored in the body's fat tissue and works quietly in the background, helping calcium reach bones, muscles function properly, nerves fire correctly, and blood flow reach every part of the leg. As the body ages, its ability to make vitamin D from sunlight declines by more than 75%, making older adults particularly vulnerable to deficiency. In fact, studies show that between 60% and 80% of seniors have low or borderline levels of vitamin D, often without realizing it. One of the most important roles of vitamin D is to help the intestines absorb calcium. When there isn't enough vitamin D, calcium from food passes right through the gut and out of the body. To keep blood levels of calcium stable, the body then pulls it out of the bones, including those in the legs, the femur, tibia, fibula, and the hip joint area. This constant withdrawal makes bones brittle over time. For seniors, that's a big deal because the lower body carries all the body's weight. When vitamin D levels drop, bone density follows, and fractures become far more likely even from minor falls. Research from the Journal of Endocrinology and Metabolism showed that women over 65 with low vitamin D levels had a 33% higher risk of hip fractures. Bone scans also showed significantly lower bone mineral density in those with serum levels under 20 nanograms per milliliter compared to those above 30 nanograms per milliliter. This is why experts now suggest keeping vitamin D in the 40 to 60 nanograms per milliliter range for optimal bone health, especially when it comes to the legs and hips. But bones are only part of the picture. Vitamin D also supports muscle strength in very direct ways. It binds to receptors inside muscle cells, particularly in the large leg muscles like the quadriceps and hamstrings. It helps grow and maintain type 2 fast-twitch muscle fibers, which are the very fibers responsible for catching your balance, lifting your leg, and reacting quickly when you stumble. Seniors with low vitamin D often walk more slowly, have a shorter stride, and find it harder to rise from a chair without using their hands. In fact, a large study published in the British Medical Journal showed that seniors who took 800 to 1000 IU of vitamin D daily had a 19% reduction in falls compared to those who didn't. Another trial followed 2,000 older adults and found that low vitamin D levels were strongly linked to chronic leg cramps, slower walking speed, and difficulty climbing stairs. This was not about age alone, it was about low vitamin D. The nerves in the legs also rely on vitamin D to function properly. Deficiency in this vitamin is now known to contribute to peripheral neuropathy, a condition that causes tingling, burning, or numbness in the legs and feet. This is particularly dangerous because seniors might not feel pain or pressure in the legs, which can lead to unnoticed injuries, pressure sores, or infections. In diabetic seniors, this becomes even more critical. Vitamin D helps regulate nerve growth factor and reduces inflammatory molecules that damage peripheral nerves. Studies show that correcting a deficiency can improve nerve signal speed and reduce pain. One trial even showed that people with long-standing leg numbness saw mild improvement within 3 months of correcting their vitamin D levels, especially when paired with B vitamins and magnesium. Vitamin D also plays a quiet but important role in leg circulation. It helps maintain the flexibility of blood vessels and reduces arterial stiffness in older adults with poor circulation. This is a major breakthrough. In conditions like peripheral arterial disease, PAD, arteries in the legs narrow and restrict blood flow, causing leg pain during walking and contributing to muscle wasting. A large study from Circulation Research showed that vitamin D deficiency increased the risk of PAD by 64%, independently of other risk factors like smoking or diabetes. This means that keeping vitamin D levels healthy may not only reduce pain and fatigue in the legs, but also protect the arteries from further narrowing or stiffening, especially when combined with a healthy diet. So, how much vitamin D does a senior really need? The official recommendation is 600 IU per day for those between 51 and 70, and 800 IU for those over 70. However, many experts now agree that these numbers are too low to correct deficiency. Seniors with minimal sun exposure, darker skin, or absorption issues often need 1,000 to 2,000 IU daily just for maintenance. In those who are already deficient, doctors may prescribe 5,000 IU per day for 6 to 8 weeks to bring blood levels up, followed by retesting. Vitamin D3, cholecalciferol, is the preferred form, as it raises blood levels more effectively than D2. Because it's fat-soluble, it's best taken with meals that contain healthy fats such as avocado, olive oil, egg yolks, or nuts. Food sources of vitamin D include fatty fish like salmon and sardines, fortified milk or plant-based alternatives, egg yolks, and mushrooms exposed to UV light. A typical 3-ounce serving of salmon contains about 450 IU of vitamin D, while 2 sardines offer around 275 IU. Fortified plant milk provides 100 to 150 IU per cup, and 1 large egg yolk has about 40 IU. But even with the best diet, reaching therapeutic levels of vitamin D through food alone is unlikely for most seniors. That's why supplementing daily, safely, and consistently makes such a huge difference. It's important to pair vitamin D with other nutrients for maximum benefit. Vitamin K2 helps direct calcium into bones and away from arteries. Magnesium supports vitamin D metabolism in the liver and kidneys. Calcium, when needed, should be taken at a different time of day to avoid competition with magnesium absorption. These synergies matter for seniors dealing with complex leg symptoms like stiffness, cramping, or pain that doesn't respond to simple stretching or massage. Getting your vitamin D levels checked with a 25-hydroxyvitamin D blood test is the best place to start. It's a small step with big meaning. Whether you're experiencing aching in your thighs, fatigue in your calves, or just a lingering sense of unsteadiness, vitamin D may be the missing link. It's not just about preventing disease, it's about reclaiming confidence in your movement, waking up with less pain, and walking through life without the shadow of fragility. Your legs carry you through every moment, and vitamin D helps make sure they can keep doing it with strength, dignity, and grace. Number 2, Vitamin B12, Cobalamin. Vitamin B12, or Cobalamin, is one of the most critical vitamins for preserving nerve function, mobility, and vitality in the legs of older adults. Yet it's also among the most underdiagnosed deficiencies in seniors. By age 60, the body's natural ability to absorb B12 begins to deteriorate, and by age 70, more than 30% of older adults are either deficient or have borderline low levels, defined as serum concentrations under 350 pg/ml. In populations over 75, that number may exceed 40%. These figures are even higher among those with gastrointestinal conditions such as atrophic gastritis, where stomach acid is reduced and intrinsic factor, the protein required for B12 absorption, becomes scarce. Without that factor, even eating a diet rich in B12, beef, eggs, dairy won't guarantee proper absorption. For example, the average absorption rate of B12 from food can drop to under 1% in older adults with impaired digestion, meaning that even if someone consumes 5 micrograms from food, they may absorb less than 0.05 micrograms. The neurological consequences of B12 deficiency hit the legs and feet first, because the longest nerves in the body serve the lower limbs. When B12 is low, the myelin sheath around these nerves deteriorates, leading to disrupted electrical signaling. This creates the classic symptoms of peripheral neuropathy, tingling in the feet, burning soles, numb toes, or a crawling sensation on the skin. A study published in the Journal of Neurology showed that over 50% of older adults with B12 levels below 250 pg/ml had clinical signs of sensory neuropathy, even if they had no anemia or fatigue. Of those, nearly 70% showed abnormalities in nerve conduction tests, specifically in the lower extremities, indicating that B12 loss directly affects the legs first. Another 2020 review from Nutrients found that B12 deficiency was an independent risk factor for lower extremity weakness and gait disturbance in seniors, and even mild deficiency could slow walking speed by 10 to 15%. Balance problems are another overlooked result of B12 deficiency. Proprioception, the ability to sense the position of your legs in space, relies heavily on the dorsal columns of the spinal cord, which are among the first areas damaged by chronic B12 depletion. A 2018 study in clinical interventions in aging found that seniors with B12 levels below 300 pg/ml were twice as likely to report difficulty standing in the dark or walking on uneven surfaces. In severe cases, B12-related spinal damage can cause a condition called subacute combined degeneration, where both motor and sensory tracts are impaired, leading to spasticity, wide-based gait, and frequent falls. Once this occurs, only partial recovery is possible, underscoring the importance of early detection and correction. Beyond nerves, B12 is also essential for producing healthy red blood cells. It works together with folate to support DNA synthesis during cell division. When B12 is lacking, red blood cells become large, macrocytic, and dysfunctional. This causes anemia, reducing the oxygen-carrying capacity of the blood and leading to symptoms like leg fatigue, cramping during walking, or heaviness when climbing stairs. In fact, in seniors with unexplained leg fatigue, testing for both iron and B12 deficiency is now recommended. According to a large epidemiological study published in the American Journal of Medicine, seniors with B12-related anemia had significantly lower leg endurance during timed walk tests and required more rest breaks. Low oxygen availability in the calf and thigh muscles also contributes to soreness, coldness, and delayed healing after minor injuries in the legs and feet. The causes of B12 deficiency in seniors are often subtle and chronic. Proton pump inhibitors, like omeprazole or pantoprazole, which are commonly prescribed for acid reflux, reduce stomach acid needed to release B12 from food. Long-term use, more than 2 years, has been associated with a 65% increased risk of B12 deficiency. Metformin, the first-line medication for type 2 diabetes, interferes with B12 absorption at the ileum and has been shown to reduce serum B12 by up to 20% over several years of use. Over 10% of long-term metformin users develop clinical signs of neuropathy due to this effect, even while maintaining good blood sugar control. Other risk factors include alcohol use, chronic inflammation, Helicobacter pylori infection, and bariatric surgery. Even vegetarians and vegans who avoid animal products altogether are at especially high risk unless they supplement. Fortunately, supplementation can restore B12 levels effectively. Oral cyanocobalamin or methylcobalamin doses between 500 and 1,000 micrograms per day are typically recommended for older adults, especially those with symptoms. These doses far exceed the RDA of 2-4 micrograms per day. But because B12 has extremely low toxicity, even doses up to 5,000 micrograms per day are considered safe. It's also water-soluble, meaning excess is excreted in urine. A double-blind trial published in Neurology found that 80% of seniors with leg numbness and balance problems saw symptom improvement after 12 weeks of daily 1,000 micrograms oral B12, with a 40% average reduction in tingling and burning scores. Sublingual, under the tongue, forms can be useful when digestion is compromised. In more advanced cases, intramuscular injections of 1,000 micrograms weekly for 4 to 8 weeks, followed by monthly maintenance, can rapidly restore tissue levels. In terms of diagnostics, checking serum B12 alone is not always enough. Some seniors may have normal B12 levels in the 200 to 300 pg/ml range but still suffer from neurological symptoms due to poor cellular uptake. In these cases, additional tests such as methylmalonic acid, MMA, or homocysteine levels can help detect functional B12 deficiency. Elevated MMA is particularly specific for B12 depletion and may rise even before blood levels fall. In seniors with numb legs or unexplained weakness, testing MMA alongside B12 is now considered best practice. From a dietary perspective, B12 is found exclusively in animal-derived foods. 3 ounces of cooked beef liver provide over 70 micrograms, more than 1,000% of the daily requirement. Clams contain about 85 micrograms per 3 ounces. Salmon, tuna, sardines, and fortified dairy products also offer respectable amounts. Eggs contain around 0.6 micrograms per yolk, and milk provides 1.2 micrograms per cup. Fortified cereals can contain anywhere from 3 to 6 micrograms per serving, and plant-based milks often contain 1 to 2 micrograms per cup, though absorption may still vary. For seniors who limit red meat or dairy, a reliable supplement is often the simplest way to maintain protection. B12 also plays a psychological and emotional role in leg health. Chronic deficiency is linked to depressive symptoms, irritability, and even memory loss. Seniors with leg pain or balance issues often become anxious or depressed, especially when the symptoms are unexplained. Correcting a B12 deficiency doesn't just relieve the physical discomfort, it often helps lift the emotional burden, renew confidence in walking, and rekindle energy. One study published in the British Journal of Psychiatry found that elderly patients with depressive symptoms and low B12 levels improved significantly after 3 months of supplementation, with improved mood and reduced fear of falling. Ultimately, vitamin B12 is not just about preventing disease, it's about preserving the freedom to move, the dignity to remain independent, and the joy of walking without fear or fatigue. When sensation returns to the feet, when balance steadies, and when legs regain their lightness, the world opens up again, whether through diet, careful testing, or daily supplementation. Making B12 part of your routine is one of the most powerful things you can do for leg health as you age. Quiet, simple, and profoundly life-changing. Number 3. Vitamin B1, Thiamine. Vitamin B1, or thiamine, plays a quietly indispensable role in maintaining the strength, coordination, and comfort of the legs, especially in older adults. It's a water-soluble vitamin that's involved in converting carbohydrates into energy and in transmitting signals through the nervous system. While it may not always be top of mind when people think about leg health, a shortage of thiamine can lead to an array of uncomfortable and dangerous symptoms that begin subtly: muscle twitching, leg cramps, burning feet, and then grow into serious impairments like muscle atrophy, neuropathy, and loss of balance. Thiamine deficiency, especially in seniors, is far more prevalent than assumed, and its consequences often get mistaken for other conditions like sciatica, restless leg syndrome, or simple aging. Thiamine is a coenzyme in the Krebs cycle and the pentose phosphate pathway, both of which are vital for creating ATP, the body's energy currency. Leg muscles are particularly sensitive to fluctuations in ATP because they are constantly active, whether walking, climbing stairs, or even standing still. When thiamine is low, the muscles don't receive enough energy to contract and relax efficiently. This leads to weakness, early fatigue, and cramping, particularly in the calves where blood flow and nerve demand are highest. A 2022 review in Nutrients highlighted that marginal thiamine deficiency levels that don't meet clinical deficiency but are still inadequate is associated with a 30 to 40% increase in reported muscle cramps in seniors over 65. In addition, low thiamine increases lactate accumulation in muscles, worsening soreness after simple activities like walking or getting out of a chair. But thiamine's role goes beyond muscles. Its most striking effect is in the peripheral nervous system. It's needed for the proper conduction of electrical signals along nerves, especially the long nerves that serve the lower limbs. Without it, nerves become inflamed and begin misfiring, leading to burning sensations, tingling, and pins and needles in the feet and lower legs. This condition, called dry beriberi, has been observed even in seniors with no history of alcoholism or malnutrition. A large cross-sectional study published in the Journal of the American Geriatrics Society found that 25% of seniors with unexplained lower limb neuropathy had low or borderline thiamine levels. These individuals were more likely to describe their symptoms as burning feet, tight calves, or shock-like sensations in the soles. Importantly, once supplementation began, more than half reported significant symptom improvement within 6 weeks. Older adults are more vulnerable to thiamine deficiency for several reasons. First, thiamine absorption naturally declines with age due to changes in the gastrointestinal lining. Second, medications commonly used in the elderly, such as diuretics, especially furosemide, digoxin, and proton pump inhibitors, can either flush thiamine from the body or interfere with its uptake. A 2021 study in Drugs Aging found that long-term use of loop diuretics was associated with a 50% reduction in serum thiamine in patients over 70. Third, chronic inflammation, diabetes, and congestive heart failure all increase thiamine demand, effectively depleting the body even when intake appears adequate. Thiamine stores in the body are limited and can be exhausted in as little as 18 days under high stress or metabolic demand. One of the more hidden consequences of thiamine deficiency is its impact on coordination and gait. Because thiamine helps maintain the function of the cerebellum, the brain's balance center, low levels can cause unsteady walking, dizziness, and fear of falling. Seniors often describe it as "my legs don't feel connected to the floor." In more severe cases, it can cause foot drop, difficulty lifting the legs, or a wide, shuffling gait that resembles Parkinson's disease. Studies suggest that thiamine-deficient individuals are 2 to 3 times more likely to experience falls, with a 20% increased risk of hospitalization due to hip or leg fractures in cases of combined deficiency with B12. The effects can be even more severe and long-lasting. The recommended dietary allowance for thiamine is 1.2 mg per day for adult males and 1 mg per day for adult females, but studies show that many seniors consume less than 80% of the RDA. Additionally, thiamine needs increase under stress, during illness, and with certain medications. In hospitalized elderly patients, deficiency rates have been reported as high as 35%, especially among those on diuretics or with congestive heart failure. In one study, nearly half of patients over 65 admitted for leg weakness or falls had thiamine levels under 17 mol/L, which is below the threshold considered optimal for nerve health. Good dietary sources of thiamine include pork, sunflower seeds, lentils, green peas, whole grains, and fortified cereals. A 3-ounce serving of pork contains about 0.8 milligrams, or roughly 70% of the RDA. 1 cup of cooked lentils has 0.3 milligrams, and sunflower seeds provide about 1 milligram per quarter cup. However, thiamine is heat-sensitive and water-soluble, so long cooking times in boiling can leach much of the vitamin from food. Seniors who rely heavily on refined grains, processed meals, or low-protein diets are at even greater risk of deficiency. Supplements are often the most effective way to correct thiamine deficiency in seniors. Standard daily doses range from 50 to 100 milligrams of thiamine hydrochloride, though in cases of neurological symptoms or muscle atrophy, higher doses, 100 to 300 milligrams daily, may be needed for a few months. The body typically excretes excess thiamine through urine, making it very safe even in high doses. Thiamine mononitrate and benfotiamine, a fat-soluble derivative, are often preferred in supplements for their superior absorption and longer activity. Benfotiamine in particular has shown strong benefits in reducing diabetic neuropathy symptoms and may help regenerate damaged peripheral nerves. In a randomized trial, seniors with leg pain and burning from neuropathy experienced up to a 50% reduction in symptoms within 8 weeks of daily benfotiamine supplementation. Correcting thiamine deficiency can lead to dramatic improvements, not just in leg pain or muscle function, but also in confidence, posture, and emotional well-being. When muscles stop twitching, when the burning stops, and when steps feel light instead of labored, people often describe feeling years younger. Even seniors who thought they were just getting old may find that what they actually needed was metabolic support, not resignation. Thiamine offers a simple, inexpensive way to protect the legs, restore physical energy, and reduce the slow creep of frailty that can steal independence. When combined with proper hydration, protein intake, and regular movement, it becomes one of the cornerstones of lasting leg health, especially in the later decades of life. Number 4. Vitamin K2. Vitamin K2 is an essential nutrient that often goes unnoticed, yet its role in maintaining leg health, particularly in seniors, is profound and multifaceted. As we age, maintaining bone density and cardiovascular health becomes crucial to prevent conditions like osteoporosis and peripheral arterial disease, PAD, both of which significantly affect mobility. Vitamin K2 is vital for directing calcium to the bones, ensuring its proper utilization, and preventing its harmful deposition in the arteries. Its dual action in both bone and vascular health makes it indispensable for preventing fractures, improving circulation, and supporting leg function, particularly in older adults. One of the most important functions of vitamin K2 is activating proteins that regulate calcium, ensuring it is deposited in the right places in the body. Osteocalcin is one such protein, and vitamin K2 activates it, allowing it to bind calcium and direct it to the bones, which enhances bone mineralization. This is particularly important for older adults, who are at an increased risk of osteoporosis, a condition where bones become weak and brittle, increasing the risk of fractures, particularly in weight-bearing bones like the legs. Research has shown that vitamin K2 is crucial for maintaining bone density and preventing osteoporosis. In a 2013 study published in Osteoporosis International, postmenopausal women who took a daily dose of 180 micrograms of vitamin K2, -7 Malawi and Quachas, for 3 years had an 8.6% increase in bone mineral density in the spine and a 7.5% increase in the hip, compared to those who took a placebo. Furthermore, the study revealed a significant 60% reduction in fracture risk in those receiving vitamin K2 supplementation, emphasizing the vitamin's importance for reducing fractures related to weakened bones. Vitamin K2's role in bone health is further supported by another study published in the American Journal of Clinical Nutrition, which found that higher vitamin K2 intake was associated with a reduced risk of fractures and increased bone strength. The study found that individuals who consumed more than 45 micrograms of vitamin K2 per day had a 30% lower risk of hip fractures compared to those who consumed less than 20 micrograms. This finding underscores the critical role vitamin K2 plays in bone metabolism and suggests that a modest increase in intake could significantly reduce fracture risk in seniors. In populations where osteoporosis is prevalent, such as in postmenopausal women and the elderly, ensuring sufficient vitamin K2 intake can be a game changer in reducing the incidence of fractures and related injuries. While its role in bone health is widely recognized, vitamin K2 is equally vital for preventing and managing vascular diseases, particularly peripheral arterial disease, PAD. PAD occurs when the arteries in the legs become narrowed or blocked, often due to the buildup of calcium and other plaque. This reduces blood flow to the legs, causing pain, cramping, numbness, and, in severe cases, amputation. Vitamin K2 helps prevent the harmful deposition of calcium in the arterial walls, a key factor in PAD. The mechanism behind this is the activation of matrix GLA protein, MGP, a protein that inhibits vascular calcification. Without sufficient vitamin K2, MGP remains inactive, allowing calcium to accumulate in the arteries. This calcification reduces the flexibility of the arteries, contributing to the development of PAD. A 2015 study published in the Journal of Clinical Endocrinology and Metabolism found a strong correlation between vitamin K2 levels and the risk of PAD. The study showed that individuals with higher vitamin K2 intake had a 20% lower risk of developing PAD compared to those with lower intake. Furthermore, individuals with low vitamin K2 levels were more likely to experience arterial calcification, which exacerbates the symptoms of PAD. This finding emphasizes the importance of vitamin K2 in maintaining healthy arteries, improving circulation, and preventing the onset or progression of PAD, a condition that can severely affect mobility and quality of life. The prevalence of vitamin K2 deficiency is a growing concern, particularly among older adults. While vitamin K1, found in leafy green vegetables, is commonly consumed, vitamin K2 is less abundant in the diet. Foods rich in K2 include fermented foods like natto, fermented soybeans, hard cheeses, and animal products such as egg yolks, liver, and butter. However, many seniors may not consume sufficient amounts of these foods, making supplementation an effective way to ensure adequate intake. Studies have shown that even small increases in vitamin K2 intake can lead to significant improvements in bone density and vascular health. In a large-scale observational study published in the American Journal of Clinical Nutrition, researchers found that adults who consumed more than 50 micrograms of vitamin K2 per day had a 30% lower risk of hip fractures and a 20% lower risk of cardiovascular disease. These findings suggest that vitamin K2 plays a protective role in both skeletal and cardiovascular health, making it a critical nutrient for seniors. In terms of supplementation, the most commonly used forms of vitamin K2 are -4 Malawian kwaches and -7 Malawian kwaches. -4 Malawian kwaches is typically found in animal products, while -7 Malawian kwaches is derived from fermented foods. Both forms are effective, but -7 Malawian kwaches has a longer half-life in the bloodstream, allowing for more consistent benefits with lower doses. Research has shown that daily doses of 180 micrograms of -7 Malawian kwaches can significantly improve bone mineral density and reduce fracture risk in postmenopausal women. Additionally, -7 Malawian kwaches has been shown to activate MGP, reducing arterial calcification and improving vascular health. In a 2018 study published in Atherosclerosis, supplementation with -7 Malawian kwaches was found to reduce arterial stiffness in individuals with high blood pressure, a common risk factor for PAD. The study concluded that -7 Malawian kwaches supplementation could be a valuable tool in preventing cardiovascular disease and improving overall vascular function. For seniors, ensuring adequate intake of vitamin K2 is particularly important, as its effects on bone and vascular health are vital for maintaining mobility and reducing the risk of fractures and cardiovascular disease. In addition to bone strength and vascular health, vitamin K2 also helps modulate inflammation, a common contributor to conditions like osteoarthritis and varicose veins, which are prevalent in older adults. By reducing inflammation and improving circulation, vitamin K2 can help alleviate symptoms of leg pain, swelling, and cramping, thereby improving quality of life. The recommended daily intake of vitamin K2 varies depending on individual health status and diet, but studies suggest that most seniors can benefit from a daily dose of 100 to 200 micrograms of -7 Malawi in quachas, which is generally considered safe and effective. However, in cases of osteoporosis, PAD, or other bone or vascular conditions, higher doses may be necessary for optimal results. It is always advisable to consult with a healthcare provider before starting supplementation, particularly for individuals taking blood thinners like warfarin, as vitamin K2 can interact with these medications. In conclusion, vitamin K2 is an essential nutrient for leg health, supporting both bone strength and vascular health simultaneously. Its role in preventing osteoporosis, improving circulation, and reducing the risk of PAD makes it an invaluable tool for seniors looking to maintain mobility and independence, with research increasingly supporting its efficacy in reducing fracture risk, preventing arterial calcification, and enhancing overall leg function. Vitamin K2 should be a key component of any senior's diet or supplementation regimen. By ensuring sufficient vitamin K2 intake, seniors can significantly improve their bone density, reduce their risk of fractures and cardiovascular disease, and continue to live active, independent lives. Legs have been trying to tell you something through pain, weakness, cramps, or numbness. Now you know it might not just be age. It could be a sign that your body's missing key nutrients that are vital for strength, circulation, and nerve health. The right vitamins can make a real difference, not just in how your legs feel, but in how confident and steady you move through life. So whether you're walking across the room or walking into a brand new chapter of health, remember this: it's never too late to nourish your legs and protect your independence. If this helps you or someone you love, don't forget to like, share, and subscribe for more simple, science-backed ways to keep your body strong, one step at a time. Stay steady, stay hopeful, and we'll see you in the next one.